Now, if a patient stops breathing in front of you, this helpful medication might be able to fix it. That's right, we're talking about Narcan or Naloxone. Narcan is indicated in patients who are experiencing suspected opioid exposure with respiratory depression or arrest in conjunction with pinpoint pupils and signs of poor perfusion. We typically administer Naloxone via one of three ways: intranasally, intramuscularly, or intravascularly, with the intranasal route being the most common. For administering Naloxone intranasally, we typically start with a dosage of 2 to 4 milligrams. For doing so intramuscularly or intravenously, we can range at a dose from 0.4 to 2 milligrams. Once administered, Naloxone typically takes effect pretty quickly, within a couple of seconds to a few minutes. You should also know that a patient experiencing an opiate overdose is likely to be bradycardic, hypotensive, hypoxic, and hypercarbic. Now, because the intranasal route of administration is the most common, let's go ahead and demonstrate that real quick with 2 common delivery devices. First, we have our typical syringe. With this syringe and vial setup, we need 3 parts to administer this intranasally. We need our needle, our vial, and we need our mucosal atomation device. This is going to screw on to the end of our needle, and then our vial is going to screw on to the back of this. Once we twist that far enough to see the medication come out the other end, this is ready to push. Now what we do to administer this for the patient is pick whichever nostril is bigger, if there is one. We're going to make a pig nose by pushing this back, and then we're going to deliver the medication, not directly up the nose, but back into the mucous membrane. If we use the single dose 4 milligram nasal spray instead, it's a very simple administration process. First thing that we do is make a pig nose like we did previously. Then we're going to take our syringe, push it up into that mucosal membrane, and then we're going to push the plunger all the way down, and then we'll go ahead and discard the device. Now that you know what it does and how it works, you should also be aware of a couple of relatively rare side effects and some other things to watch out for. When we administer Naloxone, it is possible that it will not work immediately. So if we're confident that our patient's experiencing an opiate overdose, we can repeat the same dosage every 2 to 3 minutes as needed. Additionally, we want to be careful about delivering really high concentrations of Naloxone to patients with opiate overdoses, because it is possible that we could cause respiratory emergencies like flash pulmonary edema. If our Naloxone works as expected and our patient regains their respiratory drive as well as consciousness, be aware it's very likely that they're going to experience severe symptoms of withdrawal immediately after administration. And because the half-life of Naloxone is a lot shorter than the half-life of opiates, you should also be aware that if you're going to be with the patient for an extended period of time, it's likely that they might develop symptoms and they might require another dose.